har der været en tolerance overfor til milde stoffer siden 1970'erne. De bliver solgt i de såkaldte coffeeshops mange steder i Holland, men også rundt omkring på gaderne. Det er især udbredt i Amsterdam, som også er kaldet the capital of weed. 9,7% af unge hollændere bruger hash mindst en gang om måneden. Det er flere end i f.eks. Sverige, Finland og Grækenland. Men i Italien, Storbritannien og Spanien er der faktisk flere, som anvender hash. Vi har snakket med Andrew Hathaway, som er professor i sociologi på Universitetet i Guelph, Canada. Vi har også snakket med Michael Baisley, som er professor på farmaceutskolen på Universitetet i Waterloo, Canada.
My name is Andy Hathaway. I'm a professor of sociology at the University of Guelph, which is in the province of Ontario in Canada.
My name is Michael Baisley. I'm a professor at the School of Pharmacy at the University of Waterloo.
From the Canadian perspective, as you may have heard, cannabis was legalized for recreational use. It was legalized on the grounds of a public health approach.
There's good evidence for cannabis to treat nausea and vomiting in patients that are undergoing chemotherapy. There's some pretty good evidence that cannabis can help with some symptoms of multiple sclerosis or MS, certain types of pain, mostly nerve pain, pain in patients with cancer, or pain in patients that are in palliative care or end-of-life care. And there's some evidence that one of the cannabinoids, called cannabidiol or CBD, is useful in treating some very specific epilepsy or seizure conditions in young children. And cannabis can be used to stimulate appetite in patients who are underweight or need to increase their food consumption for whatever reason. So those are some of the positive effects or the reasons that people would use cannabis. As far as negative effects go, cannabis, even though I just said it can be used to treat nausea and vomiting in cancer chemotherapy, can actually cause nausea and vomiting in some people. Cannabis is used as a medicine for anxiety, but can actually cause anxiety and feelings of paranoia. Cannabis can, especially in young people, cause psychosis, so either hallucinations or delusions. It seems that side effect of psychosis appears to go away as people get older, and it mostly affects younger users.
One of the things that cannabis does as an effect on the body is expands the bronchioles. It increases your lung capacity.
Cannabis, if it's smoked, can cause various issues with the lungs and breathing.
When I mention withdrawal, that does suggest it has physiological effects, that there are levels of cannabis in the body that if cannabis use is stopped after a period of time of heavy use in particular, then there is the potential for withdrawal.
At high doses of THC in particular, doses that you might get if you ate several edible cannabis, chocolates or gummy bears, can cause increased heart rate and blood pressure and even heart attacks in very rare cases.
If I were to choose, I would say yes. It has habituating qualities to it. In other words, people who feel that they would like it even more if they tried it again. And will continue to use it for that reason. People who use it and enjoy it perhaps increase their use over time, perhaps the level of frequency. There are mild effects of withdrawal that have been documented, much in the way that somebody who has been denied their regular cup of coffee, for example. That said, there are some who develop serious problems where they cannot stop using, and that is something that potentially could warrant treatment.
My name is Sanne van Heems. I'm a psychologist at Good Hope GGZ, that is specialized Dutch healthcare with regards to addiction. Well, what we see here at Good Hope is that 1/4 to 1/3 of the people that ask for help are abusing cannabis. Most of the people are actually young people, and with young I mean between 18 and 25. Why do I think that is? What we see is that these youngsters mostly come from quite wealthy families. So they have they have more knowledge about abuse and about drugs, and especially about going off the right track. So they are more inclined to ask help at a younger age, at the younger stage of abuse. So you see that the youngsters that come from affluent families, they ask for help more quickly than people with less social economic status. It's not really legal here in the Netherlands. What we did is we had a policy of tolerance of use of soft drugs, that's the cannabis. The idea was to look at abuse of cannabis as a medical problem instead of like a juridical problem that needs to be punished. Of course, it makes you very cheerful. What we see from the people who are coming in here is that it brings your life, your social life, to a stop. In this sense that in the beginning it's all fun and party, but when you continue to smoke, you cannot continue your studies, you cannot continue your life, your social life decreases. And what we see mostly is that people start isolating themselves and they stop studying. What we see mostly with people who are addicted is that they have very big problems in setting their own boundaries, in feeling their own boundaries. What do I want? What do I not accept from people? What we see happening with most of the addicts is they don't know their boundaries. They feel that something is not going right, but they don't know their boundaries. So when their boundaries are crossed and they try to keep their own balance, they start using drugs to make them feel comfortable again.
Det Amsterdam har vist os er, at cannabis og andre milde stoffer er let tilgængelige for både borgere, turister og mindreårige. På grund af, at stofferne er vanedannende, er der mange personer, især unge mennesker, der får mange problemer ved at vedligeholde deres uddannelse og eller arbejde. Men ellers ligner det, at Amsterdam har kontrol over forbruget, og at der altid er mulighed for at få hjælp, hvis forbruget bliver for aggressivt.